40,000 Nigerians have died from the condition in 2015. Diabetes is not just a medical issue, but one with a huge multi-sectoral and socio-economic dimension.
Looking for natural ways to improve your health? Join Dr. Mercy Alogwu, expert in alternative and integrative medicine and MD CEO of Agape Health Limited, every Wednesday on Integrative Medicine as she shares simple, effective ways to manage health issues like diabetes, hypertension, arthritis, fibroids, infertility, cancer, and more. Tune in every Wednesday from 4 to 5 p.m. on Wash 94.9 FM, brought to you by Agape Health Limited, your home of complete health.
Hello and welcome to Integrative Medicine on Wash 94.9 FM. Thanks for joining us. I am Titilayo Kode. And let's take a cue straight to the World Obesity Federation, which highlights that obesity is a chronic, complex disease that is characterized by excessive fat accumulation that can significantly impair health. It is not just a matter of personal choice or willpower, but a condition that is influenced by the combination of biological, social, environmental factors. The Federation emphasizes that obesity increases the risk of various health problems, including type 2 diabetes, heart diseases, certain cancers, and issues with mobility and sleep. On the show today, as one of our naturopathic doctors in Nigeria, the MD Agape Health Limited, who has been in the business of putting smiles in the faces of individuals and families. Let us hear from her what she has to say about weight and its impact on health. Dr. Mercy Alogwu, it's good to have you here.
Thank you. It's good to be back again.
Okay, let's look at the World Obesity Federation, which says obesity is a chronic disease. Can you explain that term, a chronic disease?
Okay, obesity is a chronic disease. What do you even refer to as a chronic disease? It is a disease or a condition that has been going on for more than 3 months consistently. Now, obesity comes on, it doesn't come on suddenly. It's not something that happens overnight. No, you start piling on the weight gradually over time, and then before you know it, the fat, you're living overweight to becoming obese. And so in reality, it is a chronic disease because it does not happen acutely, it does not happen overnight. It is something that happens gradually over a period of time. I mean, anybody who is obese, they will tell you that, I wasn't, some will even say 2 years ago, I wasn't like this. So it's chronic because it is ongoing. And even onset is gradual, insidious, and solution to is gradual. So in reality, it is a chronic disease. Thank you.
All right. We have seen situations where some persons eat very little and then they still find themselves obese.
Yes.
What can you say about that?
Well, you know, when we talk, in the part 1 of this program, we discussed the causes of obesity. You see, obesity at times is not just a lifestyle choice. At times, remember we said you have the modifiable, which is under your control, like overeating, like exercising, making good nutritional choice. And then you have the non-modifiable. Amongst the non-modifiable, you have something like your DNA. You know, you see some families, all of them are big. And you see other families, all of them are thin. You can see somebody will eat, really, really eat, and they remain slim. And you see another one, before you know, the person is very little, and yes, it's storing fat. So it is 1, your DNA. 2, what chronic disease do you have? And when you come to that, let's look at something like insulin resistance, for example. It is a vicious circle. Insulin resistance, because the person has insulin resistance, the body is not properly utilizing insulin. You put the person on a vicious circle of adding on weight. Meanwhile, the insulin resistance, that weight itself leads to obesity, but the insulin resistance is not even allowing the person to get the weight off. That's one, aside the family factor. Then two, people who have hypothyroidism, people with hypothyroidism, when your thyroids are not functioning as they should, you eat a little, before you know, you're piling on weight because your metabolic process is very slow. You're not burning the fat enough. And then age also is a factor. And then things like depression. Depression will just disrupt your whole body system and make you to add on weight even though you're eating very little. The other thing we should look at again is stress. You know, stress really puts us under, under the control of the stress hormone called cortisol that can actually lower your your metabolic rate and make you pile on weight. Then on the other side again is, what is the person eating? The little they are eating, what are they eating? So that too is part of the problem. So hormonal disruption too can cause you to eat little and you add on weight. Like a lady suffering from polycystic ovarian syndrome, she also has insulin resistance aside from the disruption of her hormones, so that she may eat very little, but she will pile on the weight. So those are some of the causes of what you just asked now. Thank you.
All right, and let's zero into weight loss, which I think is what may interest many of us. Now, what are the effective ways to achieve a sustainable weight loss?
I like that question because I'm sure a lot of people are very interested in knowing the answer to that. And the operative word here is sustainable weight loss. Sustainable because you can lose weight and then before you know, you're piling it back on again. So what do you need to do to make sure you lose the weight and then you keep it off? You know, because people are always very interested. Oh, I want to lose weight very fast. You lose the weight very fast. Maybe within a week or two, you have lost maybe 5-6 kilograms. And then boom, before you know what is happening, this weight that I just lost, it is back again. What is happening? That can actually be very, very discouraging. So what do we do to lose weight and then sustain it? Number one, what is your lifestyle? Lifestyle is very, very important. And then number two, do you exercise? Number three, you cannot hurry when it comes to losing weight. Make sure you're intentional. Make sure you do a total body detoxification. I'm speaking now from the angle of naturopathy. You must have a total body detoxification because you cannot have your body clogged up. Your liver is slow. You know, that's why some people don't lose weight. The liver is so slow. It's not detoxing properly and you have toxins accumulated, and before you know, that leads to other problems. The other thing again that you can do is, for example, some people will go, they're counting calories. No, I don't support that because it can be very, very, very frustrating. So what you do is to make sure that what you are eating corresponds to what you're giving out. For example, if you have a sedentary lifestyle, why are you going to eat maybe a big bowl of eba where you know you're going to sit down all day, you're not on the move? But if you are somebody who is doing manual labor, you know you need the energy, so you know you will be able to expend that. The other thing again is to make sure you have a clean colon. A clean colon is very important. If you can fast weekly or even once a month to reset your body, that's very important. Then sleep. is of paramount importance. If you're not sleeping, your body is not going to repair itself. Then the other thing you need to do again is that you have to remember to have your medications. Like, for example, the medications that you've been put on. For example, somebody who is hypertensive. Why am I mentioning medications here in weight loss? Because it's very important. If you're sick, you cannot do anything about your health. So that's another thing that's important. Then exercise, whether you like it or not, you must exercise. And make sure that your hormones are in order. Then family support is very important for sustainable weight loss. If your wife or your spouse or your husband or any member of your family is trying to lose weight, it's very important that you give them the moral support. Don't body shame them, encourage them. And then you, the person who wants to lose and sustain the weight, you must be able to have the willpower to say, oh, I'm not going to go back to eating late at night. I'm going to sleep properly. And then take care of any health issues that you have. Because if you don't take care of things like your thyroid issues or insulin resistance, you're going to be on a vicious cycle, which can be very frustrating. So these are part of, these are part of the most important things I consider. And of course, some people advise that you eat according to your blood group. I'm not a proponent of those though. So those are some of the things you need to do to make sure you sustain the weight that you have taken off, not to pile it back on again. Thank you.
All right. We have seen some persons that have challenges even after they have they are doing their exercise, they are conscious of their lifestyle, and they still struggle to lose weight despite following an healthy diet. What do you think such persons can do?
Okay, this actually brings me to assessing a patient before weight loss. Incidentally, Agape Health is organizing a 30 days weight loss program. And when I told all the participants that, look, you're going to have a one-on-one with me, they were surprised. You have to have a consultation. Why do you need the consultation? You need the consultation because it is important. Not all weight loss is as a result of poor lifestyle choices, like I said earlier. Some can simply be you having insulin resistance. Your body is resistant to insulin and it's making you pile on weight. Some could be because you have some hormonal imbalance aside from that. Some could equally be because your thyroid is not functioning properly. It could be because, unknown to you, you're depressed because people are depressed and they don't know. The other thing, again, you should ask yourself is, am I sleeping properly? Then, really, you say you're eating healthily, but what are you eating? You know, you can eat. Let me make myself an example. Where I am now, because of my lifestyle, I eat well, I exercise. But I discovered that once I relax, I will start adding on weight. And even if I want to shed weight, I need to up my exercise game to be able to shed that weight. So it's important to get to the root cause of why you are not losing weight. Until you get to the root cause and take care of it, you will just put yourself in a vicious cycle. And before you know, you'll be discouraged and you give up and you say, let me just stay the way I am, which is not healthy for you. Thank you.
All right, thank you, Dr. Mercy. You mentioned hormonal imbalance. How do that stress, sleep, impact weight loss?
Oh, that's a very, very important question too. You know, hormonal imbalance, for example, I keep going back to insulin resistance because a lot of us are insulin resistant. We have it and we don't know. For people who are over 40, 50, you go to the doctor tells you, oh, you're pre-diabetic. That pre-diabetic is just simply your body being resistant to insulin, and it is actually a precursor to type 2 diabetes. And so what role does the hormones play? For example, a man who has hormonal imbalance, for example, who is producing more of the estrogen than testosterone, will have a tendency to pile on weight. It disrupts your total body and then allows the fat to accumulate. Once more, I refer to polycystic ovarian syndrome. Then that will disrupt your body. You are not able to, your metabolic rate slows down and you're not able to burn fat. Your liver slows down. You're not able to actually get the toxins out, and that helps you to accumulate fat. When it comes to sleep, it is only during sleep that your body releases hormones that repairs the cells. So long as you don't sleep at night, because God has created us to have a cyclical 24 hours. You have 12 hours daylight, and you have 12 hours night. But modern lifestyle has now converted the night in some of us to daytime. So when you're not sleeping, your body is not repairing itself. So if you have chronic diseases, you put your body on a cortisol high, which is another hormone, that's the stress hormone, by the way, which again slows down your metabolism and makes you not to lose weight. That's the simple way to put it for everybody to understand. It just disrupts your body completely, so you're not able to put on weight. So that's what it is. Thank you.
All right, Dr. Mercy. You have mentioned some of the challenges, but what are some of the obstacles to weight loss, and how can a person overcome them?
Wow, okay. Obstacles to weight loss are a lot. Now, first and foremost, let me mention unrealistic expectations. Unrealistic expectations, like I say, for example, like I earlier said, for example, somebody wants to lose 5 kilograms in 2 days and wants to keep it off. That is unrealistic. Number two, are you willing? How do you have the willingness? This is very important, to shed the weight. The patient psyche is very important. When I get a patient who says, "Oh, doc, I want to lose weight," the first thing I tell them is that on a scale of 1 to 10, how much do you want to lose weight? And then you tell me. And after now knowing that, yes, okay, on a scale of 1 to 10, no, doc, I 10 on 10. Somebody say 12 on 10. So that now tells me that this patient is psychologically ready to start. The other thing again, of course, the economy can be an obstacle, because most of us, we just want to fill our bellies and go. And that is not actually a good thing. We need to be able to make right food choices, not just get up and have instant noodle, which in reality does not give you anything but empty calories. So the other obstacle again could be those around us. It could be those around us. Those around us could be not encouraging us. For example, a woman who is trying to shed weight, and before you know, the family is demanding for this, demanding for that. So how can she shed the weight when the family is not encouraging her? Then genetics also is an obstacle, because you don't have any control over your genetics. Your whole family may be obese, and so you just feel, no need to try. It runs in the family. Hormonal imbalance, once more I mentioned insulin resistance, can make it very hard. It can make it harder to actually process blood sugar, and difficult to lose weight. One other thing again is you have what is called leptin. Leptin is actually the hormone in our bodies, that signals the body that, look, you are full when we are eating. There are some people who have leptin resistance, and so you find that one person can take like 4 kgs of rice, sit down and eat it, because the hormone is deficient, it's resistant, and the brain is not signaling that, hey, stop, you are full. One other thing again is the thyroid. Thyroid issues, especially when it is underactive or hypothyroidism, it gives you a slower metabolism, make it more difficult. You have polycystic disease, hormonal factors, there's stress and sleep, and some medications too, and medical conditions also can contribute to you not being to lose weight. These are not all, but these are the most important ones. Thank you.
All right. You mentioned lifestyle. What's
Yes.
life for in a situation where a person is hypertensive or is a diabetic patient? What lifestyle changes can help such a patient to manage hypertension, for instance, while losing weight?
Okay. Now, first and foremost, you need to understand that hypertension, diabetes, studies have shown that if you can lose 10%, 10 to 25% of your body weight if you are overweight. I'm not saying it's only obese people who are overweight anyway, or overweight people who have hypertension or diabetes. But if you have and you're overweight, if you're able to lose 10 to 25% of your total body weight, it actually helps to stabilize. I've seen somebody who went off insulin just by losing weight. I'm not joking. Progressed from type 1 to type 2, was on insulin and was taking off insulin. So, for the lifestyle, what you need to do, if you're not active, you need to be active. You don't need to go to the gym and go and pump iron. Just walk. Walk just 20 minutes. If you can do that 3-4 times a day, that is good. When I advise people to exercise, they'll tell you, Madam, if you know the kind of walk, where they walk. So 1, exercise. 2, make sure you're eating right. 3, sleep well. 4, avoid late night eating. Number 5, always make sure you encourage yourself as much as possible, because you are your own. Be a one-man champion. Be determined. Stand in front of the mirror. Talk to yourself and tell yourself that, yes, you can do this. Then, aside from the diet and also the sleep, any underlying medical issues, make sure you take care of it. By the time you do all those as a hypertensive, there is no way you will not shed weight. There is no way that your blood pressure will not come down. One other important thing is water. Make sure you hydrate. Make sure you drink enough water, especially 30 minutes after, within 30 minutes after waking up. Make it a habit. Just take 2 glasses of warm water immediately you wake up. That's very important. Reduce your alcohol intake. Sugary drinks, all these carbonated drinks, you don't need it. You don't need any fast food. Lean more towards protein and moderate fat, and then reduce your carbohydrate intake. And before you know, your blood pressure will stabilize, your blood sugar will stabilize, and you will also lose weight. So that's very important. Thank you.
Now, Dr. Mercy, as a naturopathic doctor, how do you incorporate natural therapies such as holistic medicine into weight loss treatment plans?
No, thank you for that question. Well, there are certain complementary means of assisting a patient to lose weight. For example, acupuncture helps a lot. Acupuncture helps to move the lymph nodes and then increase the metabolic rate, which will help the patient to lose weight. There is something else we call Bibotin deep cup massage that actually helps to break down fat. There are so many means. Steam baths. There is the fast spectrum infrared ray energy room, and we don't just use it on its own. You can give. We have, for example, at Agape Health, and then we are giving to patients to do all those who are going to be participating in the weight loss program starting from the 7th of July. We are giving, you have the herbal teas. What do the herbal teas do? They help to increase metabolic rate, because a slow metabolic rate means you cannot lose weight. Then your colon must be clean. So you have the colon cleanse, you have the herbal tea. You know, there are certain products, some people, they'll say, oh, they've bought weight loss medication. All they medicine makes them do is to purge. That will not make you to lose weight. It will help, but it is not sustainable. But we do our own colon cleanse twice a week. So that is there. Then aside from that, you need to counsel the patient, because a lot of people, especially those who are obese, have low self-esteem. They are depressed, and then you need to counsel them and then bolster their self-confidence. Then aromatherapy too helps in stress reduction. There are some people who do hypnotism, but I don't do it. It's not my field. I don't do hypnotism. And aside from that too, you have enemas for people who are constantly constipated. You have enemas to help them cleanse out extra toxins. In extreme cases, you do a total body detoxification. Then, of course, the diet. Now, for the diet, for those who are afraid to come on this weight loss program that we're going to restrict you, for your diet, what we do is to get your cooperation. Number one, what do you like to eat? If, for example, you're somebody who loves rice, it's not that I'm going to tell you, stop eating rice. But what I will advise you is, if you have been eating maybe half a kg of rice, I tell you to reduce it to maybe 300 grams, and then by the side, put a lot of vegetables. So those are some of the means that we do. And then, of course, movement. You must move. Man was created to move. Man was not created for a sedentary lifestyle. It is just modernization, civilization that is making us become less immobile now. You must exercise. There's no two ways about it. And above all, I never get tired of saying what Hippocrates, the father of medicine, said. Let your food be your medicine and your medicine be your food. So those are some of the ways that we use at Agape Health to help any person who wants to lose weight to shed weight. Thank you.
All right. What role the mind-body therapy, such as meditation, yoga, what do they play in weight loss?
Oh, they play a very big role. Now, I mentioned aromatherapy. I did not mention yoga and what else? The thing is, yoga, for example, you have certain postures. I don't practice it though, but I know people who do. And periodically, we've had sessions in Agape Health. There are certain postures that help. Yoga is a complete wellness and a health and wellness exercise on its own. There are postures that you take that helps you to really, really calm down. You release your stress and deep breathing. And aside from that, it helps you to your lymph nodes to drain, and then you sleep better, which will actually assist you in losing weight and then repairing your body. I mentioned counseling earlier. That too is very important, because if in the patient's mind, the patient has a set mind that, I cannot lose weight, there is nothing you will do, because the power of the mind, of the brain over the body is amazing. By the way, your body listens to every single thing that you say. That's why you may see somebody whom you consider, you say, this ugly person, see how the person loves himself. The person has convinced himself that he's a very good-looking person, and so they behave that way. And so if what you cannot conceive in your head, you can actually not act on it. So psychotherapy too is a very important thing. We've had patients who are so obese that we've needed to send them to the psychologist for counseling. I don't do such counseling myself. I send them to the psychologist to counsel them, because most times you see that they're on the brink even of suicide. So you need to pull them back from that. There are people who have mental health issues too, who actually become overweight, substance abuse, alcohol, and all that. So those things play a very, very big role, because they help you to balance hormones, help you to remove stress, help you to feel better about yourself, give you that motivation that, yes, I can do this. So that's the role that they play in weight loss. Thank you.
All right. How do you then work with your patients to identify and possibly address underlying causes of weight struggles?
Oh, okay. The first thing we do is actually a consultation, one-on-one, talk to the patient. What is going on with you, and it is important that the patient trusts us enough to be able to talk to us. Some people, I've seen women who are overweight just because they have marital issues. I've seen people who are overweight because they think they are not making progress in life. I've seen people who are overweight because they just don't know what to do. So talking to the patient is very important. After talking to the patient, same question I earlier I ask, I will ask you on a scale of 1 to 10, how willing are you to lose weight? Because it's important. If a patient who is not willing to cooperate with you, who believes that all you have to do is clap your hands and the fat will burn off, don't even go there. Let the person go until psychologically they are tuned in, they are ready that, yes, I want to do this. I'm going to be intentional about losing weight. Then at Agape Health too, because the weight, the obesity could be as a result of some diseases, we do the non-linear system diagnosis, which is a total body scan that will give us what is happening in the patient's body. So those are some of the ways that I use in estimating or analyzing whether the patient is ready to lose weight, because that readiness is of paramount importance. When you want something, you go for it, you put your all in it. Because there's no point us taking on a patient and we say, oh, you have to sleep at least 6 to 12, midnight to 6 a.m. Try and sleep. And the patient is saying, no, you don't know, I have work to do. We're not going to take on such patients. It's a waste of time. The patient will be frustrated. You too, the doctor, will be frustrated. So the way we work with them, we counsel. We also assist them where necessary in getting certain things, conducive atmospheres, and all that. I've had a situation where we had to actually admit the patient to get the patient from the family because the family would not cooperate when it comes to the patient's nourishment, to their diet. So we had to get them. And then there are patients who come here, I change out of my workloads, get into sports where we do little aerobics. And by the time you're doing that with them for 10 days, they start feeling lighter. And before you know, you don't need to prompt them. They exercise on their own. Remember, the aim is to not just to lose weight here and now, but to sustain it. So you guide the patient into a healthier lifestyle and what they should do to lose and then keep the weight off. Thank you.
All right. Thank you, Dr. Mercy. We have a number of questions here, and then we'll go through them, and then we'll come back to wrap up the conversation for today. Someone here says, Dr. Mercy, good evening. My name is Lawals, from Ajegunle, and my husband has been complaining about my shape. Please, ma, is weight okay? She wants to go for a weight operation, a surgery, an option, and what are the risks?
So there's a lot of risks ranging from the anesthesia. You could end up not waking up from the anesthesia. After you have the weight loss too, there are people who go into shock because so much fat has been removed from them. And then if you are so obese, it is likely that the surgery is not just fat removal. They have to resect your skin. There is the risk of infection too. And after that, your recovery period is not just 1 month. It can take up to 3 to 6 months. What I will advise her to do is to reach out to us at Agape Health on 0904 536 9979. And if you're so badly obese, the doctor going to do the surgery will equally tell you to go shed some weight before you come back. So I think it will actually benefit you to join our weight loss challenge that is coming up from the 7th of next month. Join us, lose some weight, and then we see how far we can take you instead of you risking your life on the operating table. Thank you.
All right, we have another one. Taiwo Grace from Ikoyi asking what's the difference between overweight and obesity?
Okay, Taiwo Ajay, the difference between being overweight and obesity is actually your body mass index. I think a body mass index of up to 29% is considered overweight. Over 30 to, I think 30 to 39% is considered obese. Then there's grossly obese and also morbidly obese. So it is your body mass index that determines your difference between being overweight and then being obese. It's a very simple thing. Your body mass index, BMI, that's what determines it. Thank you.
All right, we have another one here. Gloria from Agodo. She's 67 years. And she said her BP has not been stable for some time now. And so she wants to know what is the normal weight range to improve blood pressure.
Gloria, I don't know how tall you are. So what I will advise you, Gloria, please reach out to me at Agape Health on 0904 536 9979. Please, there's no consultation or any registration involved. Reach out to me because at that age, your metabolic rate is lower postmenopausal than it should be. So reach out to me and then we will walk you through what to do, not only to help you lose weight, but you can equally join the weight loss challenge from the 7th too. But then sensible exercise, what are you eating and when? Your heaviest meal, for example, at that age should not be later than 3 p.m., your heaviest meal. And then if you get hungry before bedtime, eat fruits. And also in the evening, your dinner should be your smallest and lightest meal too. And then make sure you take a walk at least 20 to 30 minutes, 4 times a week. And grounding, that's walking barefooted on grass or on ground, at least twice a week will help you to really, really lower your blood pressure. I don't know what what medications you are on. So please call us and then we will walk you through. Because this has to be holistic, personal to you as Gloria, not a general thing. I've given you the general tip, but let's go holistic, one-on-one, and then we'll walk you through. Thank you.
All right, we have another one here, Mrs. Johnson Olayemi from Alawusa. And she says she's a diabetic patient. She's 58 years old and asking potential benefits of losing weight regarding being a diabetic patient.
Oh, Mr. Olayemi, when at the beginning or in the middle of the program, I did say research has shown that if you drop between 10 to 25% of your total body weight, it actually helps you to stabilize. I have seen this a lot. Patients who are told, oh, you're type 2 diabetes, they come. But by the time we're stabilizing their weight, they drop 10, even 15% of their body weight. You discover that their doctors tell them, what's happening? Your blood glucose is stable. You don't need to take medications anymore. Just control with diet. Then what are you eating? How active are you? All these questions also are things I would like to know. Are you sleeping properly? Have you checked your thyroid and all that? So what I will advise you, Mrs. Olayemi, kindly reach out to us at Agape Health on 0904 536 9979. Then, by the way, Mrs. Olayemi, there are supplements you can take too that will help you if medications alone are not helping. There are supplements you can take that will help you to actually stabilize your blood sugar. And the weight loss is very important if you're overweight too. Thank you.
All right, Emmanuel from Ojota. Please, ma, what should I do if I experience weight regain?
Emmanuel, if you experience weight regain, it probably means that you may have gone back to an unhealthy habits. Remember, we talked about sustainable weight loss. Don't go back to the unhealthy activities that made you pile on the weight in the past. For example, make sure you're exercising, make sure you're drinking enough water, sleep at least 6 hours night sleep a night. And aside from that, make sure you control your emotions and your stress level. And also, I've mentioned that your heaviest meal should not be more than 4 hours before you go to bed. Avoid unhealthy snacks. If you're doing all these things, I'm sure the weight will stay off. Thank you.
All right, another one, Precious from Akpakpa. I like eating junks, and I want to ask that are there some certain eating pattern? Are there some healthy junks I can take?
You already, the name alone, junk, already tells you that it is junk. Junk means rubbish. So I don't know of any healthy junk you can eat, but you can eat healthy snacks. Instead of eating meat pie and all that, why not try and transfer to healthy snacks, transfer to fruits, transfer to some vegetables? That will really, really help you. And aside from that, are you eating it every day? Because junk too can be addictive, What you do to win yourself, I'm not saying suddenly stop, because it also has its own side effects. When you suddenly stop a habit, you will not sustain it. If you're eating like every day or more twice a day, try to reduce and then gradually win yourself off them. You don't need them, because as a lady, I don't know how many years you are, if you are childbearing and you've not had any children, then you're not doing yourself any good at all. Remember that fat actually covers all the organs in your body and disrupts your hormone as a woman. So you have to decide too, like I said, that look, I don't want to do this. Should you need support, kindly call us on 0904 536 9979, and we'll be glad to guide you. Thank you.
All right, we have another one. I'm Ben from Yaba, and okay, can you explain the healthy way to lose weight and avoid getting it back? I think you just have to retreat on that.
Okay, Ben, we've gone through that. Can you please reach out to us at Agape Health on 0904 536 9979, and we'll take our time to explain to you. But the basic of it is be more active, drink water, make sure you're not eating heavy meals at night, avoid too much stress. These few tips will help you. But if you want more, please reach out to us. We're not billing you. Just let us know you're from the program and we will attend to you. Thank you.
All right. Share with us how you support your patients at Agape Health in maintaining their weight loss over time.
So when you come and we after the first engagement, we are with you all the way. You're going to have calls. You're going to have encouragement. We also periodically, we ask you to come in to talk to us one-on-one to encourage you. We give you personalized meal plans, also advice on not just what to eat, but sleep time, wake time. And then aside from that too, there are therapies we have, and also herbal teas and mixtures that will help you to take the weight off and also keep it off. And one other important thing again is we make sure that we keep track of you. Not that you've shed the weight, we let you go. No, periodically somebody is going to call you, engage you on what you are doing to make sure you know that, somebody is keeping track, somebody cares. Because at times, all somebody needs is just to know that somebody out there cares about them, what they are doing with their lives and all that. And aside from that, like I said, if necessary, we refer to psychologists or to other specialists too. So those are part of the things that we do. We have a couple of patients who come back, like once in 3 months, they come and do Bibotin for 1 week, and they keep the weight off. But it doesn't mean everybody has to come back to do that. And we periodically organize weight loss challenges like we are organizing from the 7th, and people join, even though you've lost weight in the past, and you think, I've not attained the necessary weight I want to. You can still come in periodically to repeat and then drop more weight and then help you to maintain what you have to. When we say weight loss challenges, it doesn't mean you have to drop so much. Some people just come to drop only 2 or 3 or 5. So those are some of the things we do. Thank you.
All right. So, as we wrap up, can you just discuss briefly with us the Agape Holistic Weight Loss Program coming up July 7?
Okay, July 7 was starting a holistic weight loss program. First and foremost, people are asking, why 30 days? 30 days because we're talking of sustainable. Not just you losing weight within 2 weeks, bam, 10 kgs or 5 kgs within 2 weeks and you go. We want you to do it gradually. The weight did not come in one day. So taking it off very rapidly too can affect your health. So when you register, we're going to give you weight loss tea that helps you to up your metabolism a bit. We will also give you a colon detox that you will use twice a week. There is a personalized meal plan centered around what you like to eat, not what I want you to eat. Because if it is about what I want you to eat, you will not cooperate with me. Aside from that, we will advise you on exercises that are suitable for you, because somebody may have arthritis, back pain, and all that, and not be able to do aggressive exercise. Then we tell you what supplements to take, because there are supplements you can take that will help you to lose weight and to sustain it too. And aside from that, also, those who wish can actually come in to have their therapies done here. Or you may not be at Agape Health, you can do it somewhere else close to you too. You may not come here. But once you register, I will be calling you for a one-on-one consultation too. So that's where we're starting on the 7th of July, and we are ending it on the 7th of August. And then we start another one again. It's going to be ongoing until November. So different batches will be coming on. So that's the plan for now. Thank you.
All right. So thank you, Dr. Mercy, for this educative edition on integrative medicine. Join us same time next week as we'll explore more on our health. Thanks for listening and stay alive. I am Titi Layokode. Good evening.
Wash 94.9 FM.